Thanks everyone for being with us today. This is my first time to participate in those WebEx sessions. Pretty familiar with the work Joanna does, but somehow I was never able to join those sessions. As Joanna indicated, I'm working here in Amman in Jordan with the UNICEF regional office on child protection, both child protection in emergency and child protection system building. And before joining UNICEF a few years ago, I worked with a number of NGOs in the disability sector. In the Middle East as well, but also in Africa and in Southeast Asia. So the idea today, because we only have maybe 45 minutes from now, is really to focus on children with disabilities in emergency. Joanna, if you could show the next slide, we can have an idea of what is it we will be looking at today. Joanna indicated that we will take some time in the middle of the presentation to take some of your questions. So I'll ask you to make sure you remember them, write them down, so that we are sure we don't miss anything when that time comes. So we'll look at terminology, classifications, which are quite important notions in this sector. We'll talk about the relation between disabilities, child protection issues, and how emergencies can exacerbate some of the risks. We'll discuss how disability issues can be incorporated into child protection in emergency responses. Joanna? And we will also, without getting too legalistic, but we will look at some of the frameworks, legal frameworks and principles that apply to both disability and child protection in emergency. And we will discuss this notion of right, disability issues as a right issue, and the importance for us to not only promote specialized services, but also the mainstreaming of disability issues into broader sectoral interventions. Next slide. Those of you that have already worked in the disability sector will be familiar with that. However, I think it's an important distinction to make between impairment on the one hand and disability on the other. So when we talk about impairment, we refer to physical, intellectual, mental, or sensory conditions that limit a person's functioning, whether personal or social, compared with other people that do not suffer the same impairment. This means that impairment is something individual. The two persons with the same impairment might not be impacted the same manner. And impairment can result either from birth, illnesses, injury, and it can affect someone's function, meaning the mobility, the dexterity, the ability to learn, to communicate, interact with other people, hear or see. Disability, on the other hand, is social. That usually results from the impairment itself, but also from social and environmental barriers that impact on the capacity of a person to participate in society. This is why disabled people activists refer to disability as an issue of rights. What is important is to realize that disability is a dynamic notion. This is something we will all experience at a point or another. It's easy for us to understand that, for example, elderly people, because of their condition, are impacted in the way they can function in society, in the way they can perform certain functions. You are probably aware with an older approach to disability, which was purely medical, purely looking at the individual, looking at the impairment, without sufficient consideration to the social dimension of disability. This is why we talk about medical and social models of disability. Next slide. So that's quite an important one. This highlights why is it we need to be aware of disability issues when it comes to child protection in emergency. First of all, the overall numbers of people and children with disabilities. Those are our estimates, and 95 million of children below 14 with moderate to severe levels of impairments, 13 million of them with severe disability. We also know that violence against children with disabilities is usually higher than it is against other children, and we will discuss that a little bit further later on. We talk about violence, but neglect, lack of care is also an issue affecting young children with disabilities, explaining the higher rate of mortality amongst them. Next. When it comes to emergencies, humanitarian context, important to acknowledge that young people, including children, are particularly affected by disasters. When it comes to the consequences of armed conflict, children in general are heavily affected. Oh, you're going too fast. Yes. Children in general are heavily affected by weapons such as landmines and explosive remnants of war, which are sometimes designed to hurt children more than they hurt adults. And some interesting data from IFRC giving us an estimate of how many children are injured or impaired for every children killed during a conflict. Next. Next slide, please. Since one of the focus of this session is to prepare trainers to take into account disability issues in their work, those scenarios are probably can come handy for you when you want your trainees to project themselves in a situation where they would have to design, evaluate, monitor a program, a child protection in emergency program, and try to make it inclusive. This is far from being exhaustive. This is just to give you some ideas. Of course, it will be interesting to hear from you whether those are experiences you are familiar with, or whether you have seen other contexts you'd like to share. The first scenario is about a child with disability who is unable to escape a disaster due to moving difficulties. The child is using a wheelchair. Disaster being either a natural hazard like a tsunami, floods, or caused by a conflict. Another scenario interesting to consider to trigger the thinking and the conversation going is the fact that a child with disability can be dependent on either assistive devices, whether a wheelchair, crutches, but also hearing aids, or a white cane, for example, but also dependent on caregivers. An emergency can cause the loss of the caregiver or the loss of the device, which would impact on the child. And here we have the example of a child with an intellectual impairment left without a caregiver in a very difficult situation in terms of communication. Another scenario would be a child who is separated from his or her family with a visual impairment, not able to function in a refugee setting because finding it difficult to locate health services, food, and water distribution sites. The fourth scenario we have is the example of a child who acquires a physical impairment as a result of a conflict, in that case caused by a mine, who, depending upon the context, can face difficulties accessing the right physical rehabilitation services she or he would need to get back to a more normal life. And we have a last scenario that refers to some of the beliefs around disability and the negative impact it can have on a family to have a child with a disability. Can have an impact on the child because the child is kept hidden, not to reflect badly on the family in the eyes of the community, but it can also impact negatively on the family in the sense that it makes the family less mobile, more isolated in the community. So those are just scenarios for us to keep and use to encourage trainees to think about what should be child protection in emergency responses in those contexts. Next. So what do we mean by disability-inclusive child protection in emergency? Children with disabilities are often invisible and or neglected in humanitarian programs and have to face negative attitudes and challenging environments. In several context, we've observed that children with disabilities are more vulnerable than others to physical and sexual violence, abuse, and we've seen that a child with disability might be impacted negatively by an emergency in the sense that it makes it more difficult for him or her to anticipate and understand signals, ask for help, and basically protect themselves. Next. So what is it we are trying to achieve through inclusive child protection in emergency? We try to prevent and protect against the effect of armed conflicts, natural hazards, emergency situations that can have on children's physical, psychological well-being, as well as ensuring their rights to survival, development, well-being by supporting protective environment for all children, irrespective of their age, sex, disability, ethnic, and social origin. That's quite important to flag. Inclusive child protection in emergency doesn't mean developing specialized, targeted programs for children with disabilities. This is mostly, I'm not saying this is not necessary, I'm just saying that when it comes to child protection, This is mostly about making sure that the interventions we put in place consider disability as it should be. Next. So some of the frameworks we are using. Before talking about UN documents, I should stress that in any context, whether we are a child protection person or not, we should, as much as possible, be aware of the existing legislation, of the national legislation, existing policies, existing programs in favor of children with disabilities. Then, of course, in addition to that, the UN Convention on the Right of the Child applies. There are a few articles that refer specifically to disability. We also have the UN Convention on Persons with Disabilities. Always useful to know whether the country where we are working has ratified or not that convention. Next. And then we have here a few principles around an inclusive approach, which is about ensuring full, effective, and equitable participation of children with disabilities from the assessment, but also decision-making and programming stages. It needs to address social, attitudinal, informational, and physical barriers. This is a lot about ensuring access to both mainstream and specialized services, and looking into mainstreaming disability throughout the design, the planning, the monitoring, the reporting, and the evaluation of our work on child protection issues. Next. Of course, the issue of accessibility is essential. Unfortunately, when it comes to accessibility, what we think about first very often is physical accessibility. That's important. However, this is not sufficient. Accessibility is also meant to enable people with sensory impairment, people who are blind, people who are deaf, to access information and to contribute to discussions, assessment, debate, planning. So important we don't limit ourselves to physical accessibility. Since we are talking about right issues, this is a lot about self-reliance and active participation, and obviously age, gender, and factors like ethnicity can play an important role. Next. So here I'm going to go through some of the key interventions when it comes to child protection in emergency, trying to highlight how we can incorporate this disability notion. So disability inclusive child protection emergency response, we've seen that. This is about improving identification and response to specific protection risks and needs faced by children with disabilities. In child protection in emergency, I don't know how many of you are familiar with UNICEF core commitment to children in a humanitarian context. All that sounds like big words, but basically this is about defining the key areas UNICEF is committed to in terms of child protection in an emergency, and the next few slides more or less follow this framework. One of the first commitments, and I should say that obviously those commitments are not specific to UNICEF. Many of the agencies you are working for or who've been involved with have more or less the same commitment, even if it is formulated slightly differently sometimes. One of the first commitments is about assessing the risks and the needs of the population we intend to serve. If we want to have a disability perspective, it's essential we consult with disabled people organizations in all their diversity, whether we are talking about parent groups or we are talking about organizations of disabled adults, as well as other civil society organizations, public bodies, NGOs, religious groups, community-based organizations, who will be able to provide us information on both child protection issues and disability. It's key to include children with disabilities and adults in all protection, reporting, monitoring, and evaluation efforts. The objective being to identify and prevent child protection issues such as neglect, abandonment, physical and or sexual based abuse, exploitation, trafficking, separation or abduction from family members, as well as issues of discrimination and stigmatization. Here, important to flag to people involved in those activities that they should also keep an eye on disability issues and then consider disabled people, children with disabilities as one of the groups they need to monitor in particular. Next. Yeah, we've mentioned the fact that children with disabilities, because of their impairment, but also often because of the way they are seen in society, are in several contexts more likely to be exposed to violence in all its forms. Next. After assessing the issues and the risks, it's important to identify what is there in terms of response. So important to strengthen and or establish appropriate child protection mechanisms or networks, including social workers, health, education sectors, law enforcement officials, NGOs, including NGOs working in the disability sector, including disabled people organizations. From that, it is essential to either strengthen, map out, or create from scratch an effective referral system, mapping the different services involving disabled people organizations, but also all the other potential service providers for frontline workers to be able to deal with the cases they come across, but also refer cases to more specialized services whenever this is needed. In emergencies, in terms of child protection, children's separation from their families can be one of the key issues we have to deal with. This is why it's important to extend family tracing services to include and reunite children with disabilities with their families, or for us to explore alternative care possibilities. Important to consult with children with disabilities on what is it they want in terms of reunification and durable solutions. And important when it comes to reunification to invest on reunifying children with disabilities who are sometimes more difficult than others to bring back to their families for a number of logistical but also attitudinal reasons. When it comes to psychosocial programs, from specialized services to more informal, semi-structured activities, it's important to ensure that children with disabilities have access to the different activities that are offered. Next. When we respond or try to prevent child protection issues in an emergency, we work on raising awareness of the communities, of the officials we interact with, and we design messages around issues that are felt as acute and in need of being brought to the attention of the population. It's important this is done in an inclusive manner so that on the one hand we address issues that matter to children with disabilities, but we also do it in a way so that people with disabilities, children with disabilities, have access to the information we are conveying. The same way we work around community mobilization, we want to support self-help support groups from children with disabilities themselves, but also with their parents and caregivers, and encourage mother and child groups that can provide a forum for parents to meet, to share coping strategies, and for children to play. We will promote children with disabilities participation into whatever community-based child protection mechanisms, often informal community-based child protection mechanisms we encourage, to make sure that we have their point of view in reporting and monitoring what is happening to that community. Next. Lastly, in child protection emergency response, next to the work we do on awareness raising, tackling specific issues, we also want people to be aware of existing national legislation and policies, but also people to be aware of child rights in general and the rights of people with disabilities. In particular, targeting key players within the community we are working with, whether they are community or religious leaders, health or education staff, and so on. I think this is where we will take a few questions before we continue.
Great. Thank you, Laurent. I'll just bring everyone's microphones back on. And as Laurent said, we have a chance to kind of ask any clarifying questions, or maybe give some examples of things that we've, seen or presentations we've made. Perhaps I could get the ball rolling, Laurent. I'm wondering if you have any suggestions of kind of good exercises or best activities to do if we do have a bit of time with the group that we're working with, that highlight some of these barriers or opportunities, even strengths that people with disabilities have. Do you use the power walk to do that, or do you have other kind of scenarios or activities that have worked quite well in drawing out these issues?
Yes, two examples. One, indeed, whenever we do a power walk, for people to realize how different factors can affect a child's ability to be protected, or likelihood of being exposed to child protection issues. When we distribute the roles, I think it's always a good thing to have a few of the participants asked to play the role of either a child but also an adult with a disability, and possibly to go beyond the person in a wheelchair or the child with a prosthetic. I think it's also important to think about people with learning difficulties, with who are slow learners, but also to think about people who suffer from fits, because often those are not the types of disabilities we take into account. But I don't want to delve too much into that example. There is another exercise that we use to suggest disability workers, community disability workers, whereby we were asking them, it's like a twofold exercise. So first we would take a child, we would ask them to think about a child in their own community, and ask them to think about all the things, all the activities, all the interaction a child is involved in, from the minute the child wakes up in the morning until the time the child goes back to bed in the evening. listing all activities, all person she or he is interacting with, places she or he goes, and so on. Of course, this is an opportunity to map what children from that particular community are doing in any given day, during any given day. And then you can, it depends how people have been working, whether they've been working individually or in groups, but then you can go towards one of the groups and say, okay, now please imagine your child, the child you've been thinking about, he's a child who is deaf. And look into all the activities you've listed and try to figure out how that impairment could impact on all those daily life activities. And then the next step would be to ask people to think about ways for us as either a disabled people organization, a service provider, or a child protection agency, how we can, what is it we could do to mitigate some of those obstacles created by that impairment. Of course, it's more about awareness raising. It's more about people realizing how daily life can be impacted, and then on that basis, later on, you can list all the ideas that have been discussed by the groups, and look at what is it that can be done within your own agency, and what is it you need to identify partner organizations to address.
Thank you. I'm wondering if anyone else has another exercise that they use, or perhaps a question for Laurent?
This is Elizabeth. What I have to say is not about an exercise. As stated earlier, this is new to me, but as I'm listening, I'm trying to cast my mind back to my own upbringing, childhood in Ghana, and I'm thinking about notions of stigma and notions of rights of the child, how the two can be very challenging in the process, and especially when I think about the rights-based approach, which is so it's a very good thing. I'm also thinking about the challenges that come with it when people really do not accept some form of disability. And the notion of the rights, when children themselves are not aware of their rights, or there are no formalized ways of getting these children to know what their rights are. Mm-hmm. And again, the definition of disability, it's different from every community, where one form of disability may have a different meaning, from one community to another community, and then getting people to understand. For example, I remember growing up in Ghana, I heard there were some communities where when children suffer from developmental delay, some people believe that, these people are snakes, they should be sent back to the bush, shot for them, and then they will disappear. So I'm thinking that once these fundamental issues have not been dealt with, it's going to be a big challenge, to move ahead with, some of these approaches to dealing with that.
Shall I comment on that, Joanna?
Please.
Yeah.
Well, thank you for raising that. I think you are raising probably the most challenging issue around disability programming. The issue of stigmatization is extremely complex to address. It is very context specific, as you said. I would say that those are taking a very, very long time to address. And if there is stigmatization in a given community, it's probably not during an emergency that we are going to make the most progress addressing this issue of stigmatization. So I guess the challenge for any practitioner is to figure out what is the balance. I mean, how much do we want to invest in ensuring that children with disabilities are protected from violence, abuse, neglect, are accessing the services that are available and services they need at that point in time, while working on longer term attitudes and trying to develop a more anthropological, context-specific understanding of what is it that makes the community thinking that way. Who is setting the norms in that particular community? Who are the agents of change I can identify within this community to work with? Whether we can identify some positive examples from that community, and then try to analyze those more in details and use somehow use those examples to help people change. I don't have, I mean, obviously I don't have a magic answer to that very, very complex question, but it is essential because it can impact on the level of violence children are exposed to. I mean, if they are not considered as equals if children with disabilities are not considered as equals by their peers, by their parents, by the community, then it's likely those children are going to be exposed to more violence than others. And this is why it's even more important to make sure they are protected, and that child protection personnel is aware of those stigmatization issues, to make sure we don't miss anything, and to make sure that those children know that they have access, they are entitled to this protection as any other child. But I would say those longer-term attitudinal issues are better addressed in non-emergency situation, and we need to be realistic as to what is the change we want to achieve during an emergency on that front.
If there's no other burning questions then, or example to give, I think it would be best if we move on to the next part of the presentation and we keep any questions, further questions, to the end. Is that okay? I'm just speeding the button, and we can move on to the next part.
Okay. So next to child protection per se interventions, one of the roles of a child protection person is going to be to advocate in favor of mainstreaming disability, building disability into existing agendas in other sectors, not systematically adding separate specific disability activities. Often that requires the support from the management of the organizations and the appropriate resources in terms of budget, time, and personnel. We need to have in mind the fact that disability can add to other factors to make a situation more complicated and expose some of those children to more violence. And this is why disabled women, disabled girls are particularly at risk, and necessary to understand that children with disabilities, although they need to be, we need to promote an inclusion into mainstream programs, they also have specific needs that need to be taken into account. Next. Okay. One thing we can all do at our own level is to advocate for our own workplace to be inclusive. And that implies for our organizations to hire disabled people when they have the right qualifications, to do regular jobs, but also because of their unique expertise in terms of disability, their unique expertise in terms of inclusiveness. We mentioned earlier that accessibility was not just about physical access, but it was also about attitudes and the way people with disabilities are or can be perceived by others. If we want to ensure we have a workplace that is inclusive, we need to address gender issues and look at how our own policies and processes are affecting women. We need to be realistic and then take small steps and build on that. Think about little adjustments and don't expect everything to change overnight. We say we need to adapt the office, the people in the office, the attitudes, not the person with disability herself or himself. Next. So I'll go quickly over that, but those are some of the issues one needs to consider when making an organization, an office inclusive. We need to think about sign language, not sign language only for deaf people, but also for people working with them. We need to think about how technology can help people with disabilities to contribute and overcome some of the barriers they are facing. Physical accessibility, of course, but also provision of support through assistance, through additional expenses. I've mentioned how technology in terms of braille, printer, the use of specific software, how that can make a huge difference for staff. And not only, I mean, it's not just about ensuring the staff can be at work, but this is also ensuring the organization can benefit from contribution from that particular staff. If a deaf person is unable to communicate with the rest of the team, well, the team will fail to benefit from the experience of that particular person. If we want to go further and be inclusive with people with learning difficulties, that will require some specialized support, specialized mentoring. And one needs to think as well about the support, the psychological support some of those employees might need. Next. In the education sector, which is often, I think, a good point of entry when it comes to inclusive programming. So we need to look into how the education system, how the approach to education in the community where we are intervening can be adjusted to children with disabilities. We need to find allies. Unless we work closely with teachers, headmasters, parents associations, we won't get anywhere. And often we'll see that there are already children with disabilities in the schools we have contact with. We need to look at how this is working, what is not working, and how we can build from that. Next. We need to highlight how some of the changes in the approach to education can benefit not only children with disabilities, but all children. Education colleagues always insist on the fact that a child-centered methodology is not going to be benefiting only the child in a wheelchair or the blind child, but it is going to benefit every single child in the classroom. Next. We need, obviously, to identify children with disabilities who do not attend school for us to see what can be done, who are those that can be included, and those that will require a more specialized approach. As I said, we need to discuss with teachers and community-based groups to build some support. We need to understand what are the barriers or what have been the facilitating factors when we identify children with disabilities in schools. We need to acknowledge the fact that children with severe disabilities might not benefit from an inclusion into a regular school, and alternative solutions need to be thought about. We've mentioned earlier the importance of consultation and participation. Children with disabilities will be the best ones to tell us how things are working, what's not working. We also need to mobilize children themselves, whether disabled or not, and see with them how to remove some of the barriers between children with disabilities and education. Next. In an emergency, it's not always the case, but let's say that in some emergencies, especially in a camp context, distribution of food and non-food items is key to the survival and the well-being of the population. So in such cases, important to involve persons, both children and adults with disabilities, in how the programs, the camps, but also the program design and delivery are being operationalized. We need to think about specific particular barriers, obstacles children with disabilities might face in terms of queues, transport, the type of items they receive. And we need to monitor the situation. We need to understand whether children and people with disabilities benefit or not from those programs, so that steps can be taken to address any issue identified. Next. So a few points before we conclude. Again, it's not exhaustive, but the importance of consulting, involving disabled people and their organizations themselves, who have this expertise, who have this day-to-day experience, who will be able to help us make our program more inclusive from the start. We need to avoid jargon and make sure that we speak a language our counterparts, whether national, international, whether from our sectors or not, will understand. And then we need to look at how they do things and how disability can fit into that. We need to encourage the mainstreaming of people with disabilities, in the sense that we cannot develop and then support specialized services and programs for all people, all children with disabilities. If we want to have an impact, if we want to ensure they continue to be part of the communities they come from, we need to make sure they are taken into account in regular mainstream programs. We need to remember this is a right issue, and that mainstreaming is one way to promote that approach. Lastly, we need to be prepared to the fact that disability is addressing disability issues is a very long process, and as we heard earlier, one of our colleagues mentioning how stigma is difficult to address. We need to know that this will, in most cases, this will take years to change, but it is important to be aware of those stigma if we want to ensure children with disabilities are as well protected, if not better protected than others, due to their specific vulnerability. that is it for this afternoon. Those are just two videos you will find on YouTube. They will not help you so much in terms of programming. However, in terms of how it feels to be a disabled person in our world, they are quite inspiring. They are from the West, and they have not been shot in India or Syria. Unfortunately, the condition of children with disabilities in the South is not as well documented as it should be. In terms of resources, I'd like to, I'll find a way with Joanna to share with you two really interesting documents I found really hands-on, really practical. One is a guide developed by VSO about mainstreaming disability into programming. The other one, and one of our colleagues might be familiar with it, the other one was developed with UNHCR and Handicap International, and this is about disability in camp settings, which I found very clear, very straightforward, and with a few tips you might appreciate in the field.
Thank you, Laurent. As Laurent mentioned, I can pass around not only this presentation, but also the resources that he's mentioning, so that everybody, certainly on this call, gets them. And if you're dialing in or watching this presentation later, then we'll make sure that they're integrated into the presentation so that people can find those resources online. I've reactivated all the mics, and I know that that Tony had a question.
Oh, just what were those agencies again that Laurent mentioned? Handicap International?
Okay, Handicap International is an international NGO. The two biggest sections are in France and in Belgium. They started by providing devices such as wheelchairs, prosthetics, orthotics, using local technology in Thailand 30 years ago. They have moved on now, and they've been one of the key actor in addressing disability issues in development and emergency context, and they have broadened the scope of their interventions to work on other issues such as inclusive education, people with disabilities rights, and so on. Happy to share I mean, I guess if you Google them, you will find them, and if more information is needed, please let us know.
Sean, did you have a question?
Yeah, I was going to say, it's not so much of a question except as a sort of open invitation that I'm always really keen to find better resources to use, especially with things like disabilities. People sometimes maybe afraid, you know, that they can't always picture what they can do. So videos and stuff are really cool. Just to say, one I found on the internet, you can kind of have a search for yourself, but there are one or two ones from an American organization dealing with children with learning difficulties called KITS or something, and they had just little videos to explain how to give instructions to children with learning impairments. And if you do any kind of work with children, and one of the first things is to get field workers to communicate really well to children in an inclusive way, it had some great simple techniques that were just really easy to understand. So that's quite good. And I was just going to say, yeah, but there is a bit of a lack of resources filmed in places other than America or Europe. So if anybody finds one, please let me know, because I'd be really, really keen to hear about them. The other thing I've done in a training that works really well, and I wanted to say I am advocating for this to myself and to other people, is in any training to start giving out things like somebody called them life cards, and you just hand them out at random, and then for some point in the training, one person is mute, one person is blind, one person can't get up for their lunch break, they have to be, they're like, can't move their legs, another person can't move their arms, and I have found it's been the most effective way to make people think about how to handle impairments, almost more effective than telling them techniques is just having to experience it.
Great.
On that front, one thing we've said, but I really want to underline is you have disabled people organizations in a number of countries, and I think it's really important to involve them and to help them to have them help us figure out how to approach disability in that particular context. There are also disabled people organizations based in the West, for example in the UK, that are available for consultancies, for missions in the field, and that are sources of expertise for us in that sector. And I can share a few contacts with Joanna after this call. But again, in the field, in many of the countries where we are working, there are people with disabilities. A number of them are organized, and I think it's the least we can do to engage with them and hear what they have to say about the way we are doing things and how we could improve it.
Are there questions or suggestions? I've been thinking about this issue of videos. It's always something that I'm trying to get a list together, and in fact, I'm going to be having a volunteer working with me later this year to try and go through YouTube and find more CPIE relevant videos that we can use clips of for training and awareness and so on. And I'd be very surprised if there's not some good things coming out of, interesting things coming out of India or various parts of Latin America relating to children with disabilities that could be relevant to an emergency situation, but people can't point to anything specific.
The only thing I have heard out of India, and I'll try and find it on YouTube, or you can find it on YouTube, is they did a very funny, I think it was an advert, but it's really about raising awareness about disability, and it's about a guy in a rickshaw who has a disability, but it's all kind of carefully constructed so that that you don't know that until the end. It'd be great as an animation, to just start the conversation rolling, and that comes from India.
Right. Again, if you can track it down.
If I hunt it on YouTube, I'm sure I'll get bored in other work today and find time to do that.
Lovely. Sounds good. For the greater good, after all, Sean.
Absolutely.
Okay, well, if there's no other questions or suggestions, then we probably should wrap up our session. I want to thank everyone for joining us. Some of you it's been very early in the day, some of you it's later in the day, and it's much appreciated. A big thank you, of course, to Laurent for taking time to prepare this and to make the presentation. It's much appreciated by all of us. And as he said, I will make sure that the presentation itself and any additional resources that come to me in the next day or so get piled together, and then I'll email them out to everybody who's been on this call. This is the last session for the next while, but all of your names are on our contacts list. So once we determine kind of how the technical update sessions will develop in Q3, then I'll be sure to send an alert to all of you about how we'll be moving forward and how you might be able to tap into this resource that we've been developing. It will be a little while before we're able to get this session up onto YouTube, because our technical IT person isn't with us on contract for the next little bit. So do be patient with us. For those of you who want to pass this on to others and so on, it might be a little while before I can actually get this session uploaded. I believe that's it. Laurent, any closing words?
No, thank you to everyone. I was happy to participate in this, and looking forward to the subsequent discussions.